Hello, I'm Dr. Brandt Gibson, and today we're going to talk to you about this is a group of things that can actually cause peripheral neuropathy that you can actually get control of. And this is checking out your health status to understand exactly what's going on with your health. And the idea is basically we're going to look at your past medical history, we're going to look at your social history, we're going to look at your surgical history, and even possibly medications and stuff that you're taking. So as we're looking at your whole health status, it gives us an idea of what's causing your peripheral neuropathy so we can actually modify some of those causes. Common things that we're going to look at. So past medical history, if you have diabetes or if you have family members that have had diabetes, all of that actually plays into this, because with a high-risk individual that has family members with diabetes, you can also have a risk of developing diabetes over time or having a pre-diabetes type situation where it could be part of the problem. The interesting thing is metformin can also cause peripheral neuropathy. So if you have diabetes and you have metformin, you increase your chances of having peripheral neuropathy. And so we actually talk about, are there other medications you could be using, or is this diabetic related peripheral neuropathy, and what can you do to manage the diabetes? We look at thyroid disease. Thyroid disease is one of the common systemic diseases that can cause peripheral neuropathy, that if you treat the thyroid disease, the peripheral neuropathy improves. We look at kidney disease, liver disease, lung problems, sleep apnea and COPD have both been found to have some effect on peripheral neuropathy. We look for allergies, especially, for example, a gluten intolerance, or better yet, celiac or celiac sprue type diseases where you have an allergy to gluten. It's not the gluten that's the problem. It's the fact that you're interfering with the function of the intestine, and you end up not getting some of the vitamins, like vitamin B12 is not absorbed as it should be. We look for genetic disorders or connective tissue disorders that could indicate an autoimmune type disease that could be causing your peripheral neuropathy. We look for certain types of infection. Common infections that have been shown to cause peripheral neuropathy are HIV, leprosy, Lyme disease, and even tuberculosis, especially certain medications you take for tuberculosis. We look at certain medications that you might take for an infection. Cipro, Flagyl, Levaquin, Macrobid, all of these can actually cause a peripheral neuropathy, for example. We look at heart disease, especially because certain blood pressure medications can cause a peripheral neuropathy, especially some of the statin type medications that we use for cholesterol, for example, can also cause a peripheral neuropathy. We look at types of cancer. There are certain types of cancer that can actually cause a peripheral neuropathy, as well as the chemotherapy medications, whether it's radiation or medications. All those can cause a peripheral neuropathy. We worry about anxiety. There are certain anxiety medications that can cause peripheral neuropathy, certain depression medications that can cause peripheral neuropathy. There are certain seizure medications that are used for or can cause peripheral neuropathy. We look at any gastrointestinal type diseases or problems, again, leaning more towards how is it affecting absorption, how is it interfering with the nutrients that you should be getting in your system. So we look for Crohn's disease, and we look at chronic constipation or stomach problems, indications that your system may not be working like it's supposed to, which could lead to peripheral neuropathy. We look at other chronic diseases like anemia, like rheumatoid arthritis or gout. All of these can actually indicate other problems that could lead to peripheral neuropathy. And then we look at surgical history. Are there certain types of surgeries that you're commonly having? Do you have a carpal tunnel? Have you had gastric bypass? Have you had thoracic outlet syndrome? So when you got certain disease processes where you're pressing on the nerves, thoracic outlet, neuroma, carpal tunnel, tarsal tunnel, you start leaning towards a possible peripheral neuropathy. We look at back surgeries, same thing. If you're causing injury to those nerves, you worry about that being part of the cause of your peripheral neuropathy. We mentioned gastric bypass because of absorption issues. Truthfully, any foot or ankle or hand or wrist type surgeries can lead to a traumatic type peripheral neuropathy. We also look for any types of injuries that may have been in your past that could have caused this, or traumatic type events that could cause this, even psychologically, because there are psychological pieces of this puzzle when it comes to your health status that could be affecting your peripheral neuropathy. There are actually distinct psychological situations where you have a chronic pain that would be diagnosed as a peripheral neuropathy that's actually a psychological problem that needs to be treated. We've also looked at social history. We've talked in the past about alcohol causing peripheral neuropathy and tobacco causing peripheral neuropathy, recreational drug causing peripheral neuropathy. We look at all of those to determine if they could be playing into this. We also worry about high-risk sexual activity because of HIV and some of these other disease processes that could affect the peripheral neuropathy. Why are all these important? Once you know what's causing or what could be causing your peripheral neuropathy, you can say, okay, I can treat that. I can change the medication. I can treat the disease process and start working on trying to help it get better so that we can ultimately get control of our peripheral neuropathy. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 21. So it is important to understand your health status so that you can truly get control of your health and ultimately get control of your peripheral neuropathy. Thank you.